With my interview at Eisenhower, I had the opportunity to meet all of the attendings that were working here, and I just felt a really good connection with everybody, and everyone offered something different, and everyone has a different approach of how they practice, and I think that's one of the best learning experiences that you can ask for.
Working with the Pulmonary Fellows have brought a lot of value to our institution, but a lot of personal value to ourselves as well. It's given us the opportunity to have passion for what we're doing on a daily basis. They're challenging us to learn new things and to make sure that our institution is doing the best medical care that's possible.
For residents coming into fellowship, of course, they're going to expect more responsibility. They're going to be more involved in the pulmonary pathology as opposed to being a resident where their learning is much more broad, and they are going to be treated like a full licensed physicians.
The range of pathology that we see here at Eisenhower is surprising to even physicians who've practiced in different places across the world.
So we get a lot of outpatient exposure as well, and we get to take care of patients that are critically ill, really sick in the intensive care unit. But at the same time, we also get our bread and butter pulmonary medicine consultation service. So those are the three venues in which we take care of patients.
You get to do everything in a day. You get to put in a chest tube, you get to see patients, you get to see patients in clinic, you may help out in the ICU. So it's one of the most dynamic services, but it's one of the most fun as well.
What I really like about working with the fellows is the knowledge that we gain from each other. We go over some of the stuff we know as respiratory therapists, and then they bring in more information and knowledge to us so we can all collaborate and treat our patients with the latest evidence-based practice.
Outside of work, there's a lot of benefits of being in this program and living in this area. The medical community here is super highly respected amongst all of the individuals. You do get to go to work and be at work within 5 to 10 minutes. You get to live in a nice place where it's always sunny. There's the Coachella Valley Music Festival, and there's the Palm Springs Film Festival. At the same time, if you want to run to Los Angeles or San Diego for a quick weekend, even Las Vegas for a quick weekend, definitely very possible.
The Coachella Valley is probably the best kept secret as far as quality of life goes. There's great places to eat, there's not a lot of wait. My parents actually visit here very often, and they love it.
If you know anything about Eisenhower, we do have a significant amount of support here. Our interventional pulmonologist, Dr. Thomas, has one of the first robotic bronchoscopy systems in the country.
If you are looking for a community program where you're looking at to be a great clinician or a clinical educator, I think this is a great program for you. Overall, my impression of this fellowship is very positive. I've had a great training year. I feel comfortable, performing my procedures. I feel comfortable taking care of patients in the ICU. I feel comfortable seeing patients on my own in the clinic. So overall, very good things to say about the program.